opening the door wide to new possibilities, hope of real breakthroughs and understanding more big ideas than we could have ever imagined. These are the biggest grants we've ever been able to offer. We're going to come out of this with some breakthrough ideas.
Focused solely on neuroendocrine tumors. You are not alone. We are all with you on the board.
Dr. Moadel is going to be giving us our final presentation of the day. She's a PhD psychologist who runs our program in Integrative Oncology and Complementary Therapies, Cancer Survivorship, Living with Cancer, and particular issues in living with neuroendocrine cancer, and we're really honored to have her today. So thank you. At Montefiore-Einstein Medical Center.
It's an honor to be here, and thanks for staying, for those of you who have stayed throughout this long, excellent conference. The one thing I'd ask, I don't want to ask you to get up and stretch because I'm afraid you might leave, but maybe just put your arms up a little bit and stretch. It's been a long day, just kind of let it go a little bit. And this is what we in the integrative oncology world do. We talk about relieving stress, taking care of mind, body, and spirit, right? I mean, today you heard all about taking care of your body and all these incredible medical information, but it's so important to take care of yourself on a holistic level. And I'm a psychologist, and I direct the Psychosocial Oncology and Integrative Oncology program, as Dr. Wolin talked about. And we here at Montefiore, and we are just one place of many that believe very strongly in taking care of the patient in every which way, so that you are a person, you're a human being, and you have needs, and you have psychosocial needs. So this is what I'm going to talk about a little bit today. So just to give you some definitions. So what is integrative oncology? It's defined as an evolving evidence-based specialty that uses complementary therapies in concert with medical treatment to enhance its efficacy, improve symptom control, and alleviate patient distress and suffering. So there's a lot of terms floating around that might be confusing. You've probably heard of complementary medicine and alternative medicine and integrative medicine now. What do they all mean? Okay, let me just clear that up because it can be very confusing. So the first thing is complementary medicine. Basically, it's non-mainstream practices that are used in conjunction with conventional medicine or together with conventional medicine. So that's complementary medicine. So you might get a yoga class, or you might take a yoga class and also go for chemotherapy. That's complementary. Alternative, on the other hand, is when a patient chooses to take non-conventional treatments over conventional treatments. So you might take herbal treatment, for instance, versus chemotherapy. That is alternative. That is not necessarily what we support. Of course, we support what we call, or what's called, integrative oncology. And integrative oncology is actually the model that we strive for, that I think the field strives for. However, we're not quite there yet, but we're going to call it that because we're going there. And that is when complementary practices are provided in a coordinated way with conventional care. So basically, you might go for your chemotherapy treatment and get a hand massage during that time. Or your doctor might say, we have yoga classes in the next room. After you take your radiation therapy, we want you to take a yoga class. So it's coordinated. It's not you going outside of the cancer center and getting the care yourself. That is what the ideal is, and we hope that everybody gets it. Now, until we get there, you should do it yourself. You should absolutely get complementary practices that work for you. And it's not one size fits all, so I'll talk about some that are out there. So first, there's natural products. And Dr. Yang, talked a little bit about some of the probiotics and dietary supplements. I'm not going to touch that as far as what's relevant for you. There's not too much research that I'm aware of in NETs in this botanical area that's extensive. I could be wrong, but I think more research is needed. But I'm, in general, looking at the integrative oncology research. I'm going to talk a little bit about that in a few minutes. Then there's mind-body practices, and these have been well studied in the area of oncology in general. There's yoga, meditation, relaxation, visual imagery, acupuncture, massage, chiropractic, and osteopathic manipulation, and then some Chinese healing practices called Tai Chi, Qigong, healing touch, and hypnotherapy. There's also Reiki, which is a Japanese healing art, and many of them involve breathing exercises, gentle movements, and going inside to a quiet place within your mind. So the science of complementary practices, what works? That's what we all want to know. So there's not, a definitive answer. There is a growing body of research. What we do know about mind-body practices is that they, in general, based on reviews and meta-analyses, they have a positive effect on many systems in the body. They can improve quality of life, including anxiety, depression, and sleep. They can reverse the harmful effects of stress, and they can create fundamental changes in the way the brain functions in a very positive way. They also have an excellent safety profile. So if you were going to try something first, I would say mind-body practices would be the first place to go. And again, there's such a nice array that you choose what works for you. You absolutely don't have to do yoga if you feel yoga's not for you. But just to keep in mind that not all yoga practices are the same. You don't have to tie yourself up into a pretzel to be able to do yoga. So it's important to know that. The natural products, the clinical trials that have been done have not demonstrated conclusive benefit of using natural products for cancer prevention. That doesn't mean they can't work or there aren't some that aren't positively affecting prevention, but we just don't know yet. We haven't found them. A number of nutritional supplements haven't shown promise for cancer symptom management, for chemo-induced peripheral neuropathy, for oral mucositis, and for diarrhea. As Dr. Yang said, speak with your gastroenterologist, speak with your oncology team. Everybody's different, and it's very important to, when you're doing these complementary practices, share it with your doctor. Don't do it on your own. Sometimes there's contraindications, and it's important to keep the communication lines open. And for the physicians out there, we have to be open to our patients talking about these things so that they are willing to share it with us, because they do these things, and a lot of times they're afraid to tell the doctors because they're afraid the doctors say, absolutely not. Well, they're going to do it anyway. So ask them about it and learn about it. It's important. Something like 50% of cancer patients are doing some kind of complementary medicine anyway. So in case you were wondering, this often comes up, medical marijuana for symptom management in cancer. What is the evidence? We do know that it can reduce cancer pain. It's interesting, it seems to work better for men than women. A recent study came out, but that's, again, it's not one size fits all. It may work very well in some women. It can help with nausea and vomiting related to chemotherapy. It can reduce inflammation. It can act as an antioxidant. So you have to decide with your doctor whether it might be something for you. And there are cannabinoids that can be used where you don't get a feeling of, a high or feeling out of control, which some patients aren't comfortable with. So why is this important? I started to say, we have to treat a patient mind, body, and spirit. You're facing challenges. You're diagnosed with a neuroendocrine tumor, with a cancer, with a chronic or acute illness. It affects your whole life. It affects your emotional life. A lot of people will experience sadness, which can go into depression, will feel fear, which can go into anxiety, which will experience grief reactions. You might have relationship changes and conflicts. You might feel a lack of support. A lot of times patients feel, now those people that were around me aren't around me so much anymore. They've withdrawn. It's very common to feel this sense of people not being able to support you when you're going through this. Communication difficulties with your family, your loved ones, even with your healthcare team. Body image distress, sexual impairment can occur. Cognitive loss of memory or difficulty remembering things, concentration difficulties, and changes in or losses in your work and your social role. So these are important things that need your attention. And you need to advocate for yourself. I think your healthcare team will help you as much as they can, but a lot of times they're focusing on your illness and treating it. So you absolutely have to be your own advocate. Very important. How do you do that? You have to ask questions. You have to learn about your illness and your treatment. And, as far as some people don't want to know certain things about their illness, and that's okay, but ask what you do want to know. Ask about the treatments. Ask about side effects. You don't have to know. I don't want to know the statistics about survival. It's okay if you don't. That's your right. But know what you want to know and what you want to hear, because then you'll ask the right questions. Speak to somebody who's been through it. We feel very strongly about that here. This peer-to-peer counseling is very important, to talk to somebody, and I'll talk about that in a minute. Get extra support. Get counseling if you need it. Support groups, I know that was talked about, and I know that there's a good support group system through the foundation. That can help normalize what you're going through. You're not crazy. You're going through a difficult time, and there are challenges, and that's normal. Treat yourself with compassion, and take an active role in taking care of yourself physically, emotionally, and spiritually. Find what makes you happy, what makes you feel good about yourself and your life. How do you advocate? Where do you go? There are so many specialties out there. You probably know about many of them, but you should know, and you should ask your physician if you feel like you're not getting the full care that you need. Integrative oncology programs, sometimes they call them psychosocial oncology, mind-body health. Ask around, and also I forgot to add to this list cancer advocacy programs like Gilda's Club and the community wellness, the wellness community. There's many programs out there, cancer care. There's lots of help out there, by phone, by online, and in person. You can ask for a psychologist or a psychiatrist. You're not crazy. You're going through a hard time, and you're going to have a reaction. That's all of us would, so it's okay to ask for help during that difficult time. Social workers can help with practical issues, insurance issues, any kind of home health care. Important to connect with a social worker for that. Pain management specialists exist, and just a quick comment. Oftentimes, pain management falls under the rubric of what we call palliative care. Unfortunately, the word palliative care, people often believe that means end-of-life care. It doesn't. Palliative care means symptom control. The problem is, of course, many patients at end of life need more symptom control and suffering relief than people who aren't, but that's not always true. So, if you hear palliative care, you're being referred, this is where any kind of symptoms you might have that make you uncomfortable, whether it's diarrhea, whether it's pain, fatigue, the palliative care and the pain management team can help you. Nutritionists, very important in NET. Rehabilitation, physical therapy, and chaplaincy. Sometimes we need that spiritual support. We need somebody who can give us a different perspective, a philosophical perspective, and that's okay. That's good. So we also, when you're trying to get back to normal, you're never going to get back to normal. It's going to be a new normal. But the good news is sometimes that new normal could have perks to it. And I always feel a little uncomfortable when I say this because sometimes I get this look like, you can't say that. But I've worked in the field for 20 years, and I've had many, more than I can count on two hands, patients who've said to me, cancer was the best thing that happened to me. And I said, what does that mean? I changed my whole life. I'm not the person that says yes all the time. I say no when I mean it. I appreciate my relationships. I have the best relationship with my husband now, with my children. I know they love me. My husband, or my wife, they did so much for me. I realize how lucky I am. I've got the greatest healthcare team. I don't care about the small stuff anymore. It doesn't matter. There's like this perspective that they've gained, and those are the things. That thing that sometimes we can push away because we hate what's happening to us. Those are pretty powerful, and those are the things that integrative oncology can help build and nourish. That sense of inner peace and inner, kind of contentment. So a little plug for our program for those who are in the Bronx or near the Bronx. It's called the Bronx Oncology Living Daily Program, BOLD program, and we offer a lot of these mind-body programs. We did actually start with yoga about, 15, 18 years ago, and it was a very gentle yoga. We used props, and we did a research study and found that yoga, an NCI-funded research study, yoga improved areas of quality of life in patients with cancer. So it is a very good way to start, and there's been a lot of research in yoga. So I do recommend it, but I do mention that you should make sure you're going to a yoga class that's led by a teacher who's worked with patients who've dealt with medical illnesses. Some of the testimonials, just quickly, patients talked about, I feel better, I can stand the pain, I'm more relaxed, it gives me energy, it helps with the tightness after surgery, breathing was good for my nausea, it helps me not to be so depressed, I have happy thoughts, I'm calm, I don't get as angry. It's encouraging, health-giving, and hope-providing. I can sleep better, and it even helps with my memory. So just some of the things that our patients have said. Crochet. So I bring some of these up because when we think of integrative oncology or mind-body practices, creative arts, very important. So we have this wonderful crochet group that started because a cancer survivor said, I love to crochet and I want to share it with other people. It's been very meditative for me. So this has been going on for 8 years. They make beautiful blankets, and not only do they make the blankets, they give them out to patients who are starting chemotherapy. And I think this is beautiful because it shows you sort of that cycle that when you're diagnosed and you're upset, you can do something to help you cope, whether it's, like crochet, and then you're helping other people. And when you help other people, it's an incredible, powerful mechanism to get you out of yourself, out of your sadness, out of your story of this sucks. And this is what happens. They become patient advocates, and they get out of that depressive place. Reiki healing, just example. Dance fitness, exercise is always good, and related to cancer prevention. Relaxation, and I'm going to do one relaxation exercise with you in a moment. Belly dance. So just so you know, these are things that we asked our patients here in the Bronx what they would be interested in. And they said these are the things, and so we brought them here. And healthy cooking classes, which is always very popular. So I mentioned the peer counseling or talking to somebody who's been through it. I think this is almost more important than talking to a psychologist or a social worker sometimes. When you talk to somebody who's been through it, you're immediately connected with somebody who understands. They can't give you a response like, oh no, or avoid you, or anything like. They get it. They understand. And you want to talk to somebody who has a good attitude, not just anybody, because there are people who can be very negative. So of course we have, a peer navigation program. We also call them peer navigators. They're the bold buddies. And they're screened, and they're people who have such inspiring attitudes and they want to give back. So talking to somebody like that is really important. And I know somebody asked a question earlier about, I thought they said, how can I give information to other patients? I'm not sure. Wasn't that the question? So this is one way to do it. You can join a peer counseling program, and I know there's telephone-based peer counseling programs. I don't know if the foundation has one, the NET Foundation, but they may. But it would be wonderful because it's often the best to connect with somebody who's been through your type of disease. So I think that's really important. And the benefits to patients, not only connecting with patients who understand and normalizing, it can help adherence to treatment, your ability to advocate for yourself with the healthcare team, and it reduces distress and isolation. The benefits to the cancer survivors who do this, it empowers them through becoming advocates. It gives them meaning to what they went through. It offers purpose in their lives, and it reduces distress and isolation in them too. So it's an incredible benefit, and we found over 40% of our patients want to volunteer to give back, and this is one of the healthiest ways to do it. So here are some resources. I don't know if you received the slides, the PowerPoints after this, because I don't know, will they get it? I mean, because you can always, if you can't write it down right now, these are great for learning about integrative oncology and cancer support services that are out there. Most of them are free. Cancer Care offers free phone counseling in many different languages. And you are not alone. Don't forget that. You are never alone. And if you can give me a couple more minutes, I'd like to do a very brief and sweet little meditation exercise with you. And here's your, I was supposed to give him a, so my colleague and co-director of our Integrative Oncology program, Dr. Fernando Camacho, he's an oncologist and he's a Zen Buddhist priest. And he taught me what's called Lovingkindness Meditation. And it's really beautiful. So I'm going to ask you to get comfortable, sit comfortably in your seats, uncross your legs and arms if you can. I'm going to suggest that you close your eyes if you're comfortable. You don't have to. And all you have to do is just listen to my voice, follow along, just take it in. Thank you. So, with your eyes closed, and your body sitting comfortably in the seat, Take a deep breath and let it go slowly. The Lovingkindness Meditation, as the name shows, it's all about love. So in that thought, I want you to picture yourself in front of you. You are sitting in front of yourself in your mind's eye, and you're going to send yourself your own love and attention, taking care of yourself as much as you can. And these words, take these in your mind's voice and send them to yourself. May I be happy. May I be safe. May I be healthy. May I be at peace. May I be happy. May I be safe. May I be healthy. May I be at peace. Now picture someone in front of you, someone who really loves you, who always has your back, and whose love is undeniable. It can be a friend, a family member, a pet, God, anybody. Give them the love that you gave yourself through these words. May you be healthy. May you be safe. May you be happy. May you be at peace. May you be happy. May you be safe. May you be healthy. May you be at peace. Next, I want you to think of your healthcare team, the doctors, the nurses, the social workers, the technicians, the billers, everybody in the team, and all those important to helping you recover and heal physically, emotionally, and spiritually, and send them your love. May they be happy. May they be safe. May they be healthy. May they be at peace. May they be happy. May they be safe. May they be healthy. May they be at peace. Holding on to that love and that feeling of warmth, I want you now to think about somebody who's done you harm, somebody you don't like, and picture them in front of you. Also, send them your love. May they be happy. May they be safe. May they be healthy. May they be at peace. May they be happy. May they be safe. May they be healthy. May they be at peace. Now let's think about all the people in the world, starting with those in this room, in this building, in this borough, in the city, state, and country, and this and all continents, and let's send them our love. May they be happy. May they be safe. May they be healthy. May they be at peace. May they be happy. May they be safe. May they be healthy. May they be at peace. Just let the peace of the compassion bathe you. everyone around you. Allow yourself to float for just a few moments in that love. And whenever you're ready, you may slowly open your eyes. And that's just an example of what a mind-body practice can feel like. A short, simple one. How did that feel for people? Was that relaxing? Yeah. And just know that in the beginning, oftentimes, your mind just goes floating in all different directions. That's normal. You're going to be thinking about other things. You might fall asleep. You're going to, daydream, all of that. That's absolutely normal. You just gently bring it back. They call it the monkey mind. Just bring it back and listen. But you feel it not just in your mind, but in your body. It just kind of relaxes you. It's such a beautiful sentiment. And it's something you could practice anytime. You can get these on the internet. In fact, we actually have I'll have to send it to Dr. Wolin, a relaxation hotline with the Lovingkindness Meditation on it. It's like 1-800-RELAX, but I'll have to find out because I don't recall, and perhaps it could be sent to you all. So that's it. Thank you so much for staying.
So I think we feel happy and safe and healthy. And hopefully you will carry that into traffic on your way home as well, and remind the people around you to be happy and safe and healthy as well. This has been a wonderful day. I was so glad she ended with "You're not alone," because I started the day by trying to say to all of you, you're not alone. There are a lot of people in this room and outside of this room who are here to help you and guide you and provide information and support, and I hope you found some of those people during the day as well. For those of you who feel happy and safe and have a few more minutes to share some thoughts on video, we'd love to have a few of you stick around. I see a couple of friends I'd love to have join us if you can. I want to thank Dr. Wolin, the entire Montefiore team, your staff, my incredible staff. Laren Heider's not in the room, but if you see her on the way out, would you please just tell her how wonderful the day was and how much we all appreciate what she's done to make it so. And let's give her a round of applause. We're still taping, yes? But give her a hug and give us your feedback too. So we'll do an online, we'll send you a follow-up, what worked, what didn't work, would you like to see more? Tell your friends if it was a great program, and we'll come back and do it again next year. So thank you all, and please stay if you have just a couple of comments or thoughts you would be willing to share on videotape. And again, thank you, Dr. Wolin.